We started with Chapa-De, I think, years ago. I think a lot of the patients were going to Nevada, Shears, Nevada, for their medical.
Well, yeah, when the clinic started, there was like, I say, there wasn't a whole lot in the area.
But before that, they were taking him to Shears, Nevada, once a month on a bus.
We also had a hospital we could have gone to, but it was in Fallon, Nevada. And Fallon is a long ways away, and I went there a couple times, but they would come get you at 6 o'clock in the morning. You wouldn't get back home until 6 or 7 that evening.
The reason Chapa-De exists is because of the termination policies of the federal government in California. When California tribes, and it was really only California and a couple other states, the status of tribes were terminated. They were kind of picked off because they were small compared to big tribes in other parts of the country. And it was in a period in the 1950s where federal policy was one of assimilation. That the answer to the Indian question, was to just bring them into the mainstream, make them kind of equal Americans. Really, another way of stating it would be that to just strip Indian nations of their culture completely. And it led to termination of all federal services in California, and it led to the termination of a number of tribes, including the tribes in this area.
We were in Auburn, and my dad was terminated, and so we had no affiliation with the tribe. So my mom got us enrolled in Nevada and on her Washoe side. So we were able to use the clinic at Stewart and up there. So that's how we ended up being enrolled up there, was just for health care.
I had no idea about any of this because I come from Onondaga, and although the United States government and my people are not, fond and long friends, we never got terminated, okay? But that happened here. And it happened to full-blood Native people who were told basically they were no longer acknowledged as such. How it was presented is, how would you like to be like all these other people that live all around you, and not necessarily have a reservation, but it could be your land, your own land. You own it. The reservation is an appointed piece of property that the government says is okay for you to have. And, they can change their mind. It's been proven. But this way, the government can't say anything. It's your land. We're just going to give it to you. Well, some of those families lost their land to taxes, which they didn't ever have to pay before. They lost their land to the bartender down the street. There were problems. They no longer qualified for anything. No government help.
That is an important part of the history that people really don't know about too much. But it was determination was the seed, the origin of the birth of these Indian health clinics in California. When things started changing in the 1970s, and it was really a result of the civil rights movement of the 1960s, it was extended into 1970s, and then kind of flashpoints like Wounded Knee and Alcatraz resulted in a turnaround by the federal government.
I had a friend in college, and he said his aunt was the one who authored the bill. He was over from Ukiah, so he was a Pomo guy. And he said his aunt, who worked in a bank, she wrote up this legislation, or this idea for legislation, to have health care in California.
Things were changing in California at that time for Indian health and Indian self-determination in general, so it was an exciting period. It was kind of the reversal of the prior period, and Chapa-De at that time, and still does, I think, represent that new consciousness of sovereignty and self-determination that California Indian people had really been deprived of for many, many years.
That's where Chapa-De comes from. There was a group of Native people that wanted something for their families, and they got together, and even though they didn't agree always on things, they fought more for what they wanted and needed for their families and their communities than they did with each other.
And there was a law passed called the Indian Self-Determination Act in 1976, which gave tribes the right to contract for services. In California, the situation was unique because the federal government, when it came to health care and the Indian Health Service, they pulled out completely 10 or 15 years before during that termination era, so that nothing existed here. So when the government decided to start bringing back money for Indian people, the money had to come in through some mechanism. And the mechanism was through Indian health nonprofit clinics, of which Chapa-De was one of the original ones. There was, I think, 7 or 8 original ones, and the one in this area was the Auburn Indian Health Clinic, it was called at the time.
I was hired out of the CRIB office in Sacramento to do the bylaws for the new organization. Because CRIB was the California Rural Indian Health Board, was the cover for all these clinics under that new act and that new funding.
There were no tribes to contract directly with the tribe to provide services, because the tribes didn't have any status legally with the federal government. That's why the Indian clinics became nonprofit California corporations, because there was no other mechanism available.
At that time, it was 4 counties. It was Placer, Nevada, Sierra County, and El Dorado County was its service area. So I set up these meetings in those 4 counties for community.
I just know being in meetings, a lot of meetings. From what I remember when my mom started it and Dolly, they were the people who headed it and went to these meetings.
There was many families that worked to start this, like I call her my second mom, Jenny Caton. She worked really hard at getting this, and Cecilia Ramos, she was one of them from our tribe, and they worked very hard to get Chapa-De up there to where, the tribal members would feel good about actually going.
My father's Martin Hedrick. He was a very smart man. He was chairman of the Northern Sierra Indians, which encompassed 15 counties. When we first started, he went to McClellan when it closed down and got beds, got tools, got tool chests, got anything they were giving away to nonprofit organizations. My dad bought an old beat up dump truck to haul all this from McClellan up to here, and then of course took it upon himself to hand it out.
April P. Moore was my older sister.
Yeah, April's my older sister by a year and a half.
My sister started this with Carol Irvin and all the other wonderful ladies at the time.
She was in the Indian Education Department, and then she drove a school bus, and then she was on this board. She really jumped in, she dove in. It's like all of a sudden she's everywhere.
April didn't ask for anything, 25 years, never asked for any pay or anything.
And she's the kind of person, she read everything. I mean, it's really annoying to me. She would read everything, right? Take notes all the time. It's like, take tape recorder, do something else. But she was real diligent.
She was, without meaning to or knowing it probably, kind of a mentor to me.
I just truly admired my cousin. I loved her more than you can tell, just almost like brother and sister, really. And she was a focal point, somebody when I grew up, modeling myself after.
Insatiable positivity, choosing to look at the blessings instead of everything we didn't have.
And she was always like the mom figure. She took care of a lot of people. She was right up until she died. She was that. Always making sure everybody was taken care of and all that stuff. So, just overdoing it sometimes, but just who she was.
Chapa-De has gone through so many growing pains, it's incredible now, yes. But boy, back in the day, it was It was very political, very political.
As it started getting out there, then there was ownership, which is kind of nice. And when you have ownership, you can complain a little bit, you know.
The tribes wanted to exercise their rights directly, and a nonprofit California incorporated entity was really not what they had in mind. So there was some tension there that ultimately it took a decade or 2 or 3 to resolve those tensions.
With my family, families fight.
Nitpicking and arguing over this and that.
And I remember being on the board and we had to make a change in a policy. And the people got mad. First we took care of the family. Then it was, well, we'll take care of the native part of the family. That's when it hit hard. And people didn't want to come, and they said, you people on the board, who do you think you are? And we're going, wait a minute. This is what the government's setting down. And then it became, you had to be a certain amount of blood. And then it became, well, do we want to do out of state Indians?
You know, there was definitions of who the Indian people were. They had to be on a judgment roll in 1928, and then they had to be recognized by other members of the community. It was a complicated formulas that were developed to figure out who the Indian people in California were. That act, the Indian Self-Determination Act, the way it was drafted, it didn't take into account nonprofit organizations providing health care, and membership in a federally recognized tribe was a definition of an Indian. So you ran into some serious sort of legal political problems as to who's sitting on the board. And whether is the Indian Health Service going to provide funding to an organization where half of the board are not members of federally recognized tribes? Those people had just as much legitimacy as Indian people as the members of the federally recognized tribes. There was no doubt whatsoever about that.
One of the sad and unfortunate things that I've seen also that I need to speak to, or I want to speak to, is that if Native people continue to bicker amongst themselves, it's such a huge waste of energy that could be put towards something good.
We're all here for one reason, is to help each other.
I guess it does get better. It doesn't stay bad all the time.
UAIC, the United Auburn Indian Community, its members became the governing body of Chapa-De, and that's the way it is today. Once that happened, the political turmoil pretty much ceased.
I've seen a lot of struggle and pain, laughter, beauty, growth.
I think we kept it together and made it. This far, I guess I could say I made it. And to me, I'm better off, though, than when we first started. I can say that.
And to this day, there are no Indian Health Service facilities in California because the Indian health clinics, like Chapa-De, were very successful. See, these organizations, the governing bodies, were all indigenous, local Indian people, and that really set it apart.
I'm tickled, really happy to have you folks here and have the meeting that we had this morning, where I hear they want to record and not forget where we come from, because that's so important. Hopefully it keeps the spirit of what started something alive.
Okay, in the late 1960s, I had 5 children. In those days, we were very, very poor. I took one of my children to the local dentist to have a tooth pulled. So after her treatment, I was given a bill of $200. And that was a lot of money in those days. And my mother, Audrey Taylor, her and I began talking about the need of a low-cost Indian health service in Auburn area. We discovered that there were actually a health care crisis for our Native people. Some who were living on the rancheria in army tents, and many who were living throughout the northern Sierra foothills. So we formed a nonprofit corporation in the late 60s called the Northern Sierra Indian Health Project. That was the first name we had. We also applied for additional funding from as many sources as we could find: Indian Health Services, CRIB, and other sources. We were able to secure enough resources to open up our first clinic. That's how Chapa-De got its start.